My name is Matt Kokis, and I am a registered dietitian. I'm also an exercise physiologist and board certified specialist in obesity and weight management. So looking at our objectives for today, we're going to be doing a brief review of heart disease and how to identify your risk for heart disease. We'll also be reviewing modifiable risk factors for heart disease, and then understanding the importance of nutrition for overall heart health, some dietary patterns that support heart health, and then other lifestyle behaviors that support our heart health. So, a little bit about me. I'm actually born and raised from North Carolina and moved out to Spokane back in 2019, where I went to Washington State University and am an alumni. Um, I do work and am licensed as a registered dietitian and exercise physiologist in the state of Washington. I'm also board certified in obesity and weight management. I currently work at Providence, the Advanced Heart Disease and Transplant Clinic here at the Providence Heart Institute, where I'm at today. And I'm passionate about heart health and weight management through nutrition and exercise guidance and education. Oh, a little freeze up there. There we go. So to start out the, the presentation today, what is heart disease? Well, heart disease is actually a multitude of heart-related diseases, including heart valve disease, which is weakening or leakening heart valves, heart failure, which is a pumping failure of the heart, cardiomyopathy, which is a chamber narrowing through abnormal muscle growth, arrhythmias, right, abnormal heart rhythms, aneurysms, which are weakening and bulging of blood vessels, typically in the heart. We see that a lot with the aorta, which is the main artery of the heart. Coronary artery disease, which is the narrowing of the heart blood vessels, right, typically through some sort of buildup. And then pericarditis, which is inflammation of the fluid sac surrounding the heart. So typically, when we discuss heart disease, the most commonly thought of is coronary artery disease. And so, right, that's the narrowing of the blood vessels for the heart. And there are two types. We have atherosclerotic heart disease, coronary artery disease, or non-atherosclerotic coronary artery disease. And so atherosclerosis is the deposition of these fatty deposits, also termed plaque, in the arteries, leading to narrowing and hardening of the arteries that can lead to a heart attack. And nearly 50% of all heart disease deaths are from coronary artery disease. So it is one of the most common forms. So here's a little infographic of the ones we just discussed, right? We can see, right, with the heart valve disease, that little leak in the valve there, right? Aneurysm, we see that bulging and weakening of the aorta. And then I always like to point out cardiomyopathy, right? The thickening of that heart muscle. A lot of times people are like, well, I want a nice strong heart. But this is not the kind of strong heart that we want, right? Because it decreases the size of the chamber. So it decreases the amount of blood we can fill into it and how well that heart can kind of pump that blood out. So some fast facts about heart disease. Heart disease remains the leading cause of death in the United States for men, women, and people of most racial and ethnic groups. It is only followed closely by cancer in the United States. In 2022, according to the CDC, around 702,880 people died of heart disease, which is equivalent to about 1 in every 5 deaths. So it's a pretty significant number that we really want to focus on and make sure that we're supporting our population in our community in. Based on their statistics, one person dies every 33 seconds from a cardiovascular disease, right? And in the US, someone has a heart attack every 40 seconds. And about 1 in 5 of those are silent, meaning that the person is unaware that they're even having a heart attack, but the damage is still done, which is a little scary to think about. So, additionally, based on all of this, the heart disease cost the US about $252.2 billion between 2019 and 2020. So it's a big driver of medical cost and care, and it's something that we want to keep focusing on and making sure we're reducing that cost burden for everyone. Additionally, again, as we discussed previously, the most common type of heart disease is coronary artery disease, with about 1 in 20 adults over the age of 20 having coronary artery disease. So what are the warning signs of heart disease? Some early warning signs to keep an eye out. Number 1 is going to be chest pain, also called angina. Number 2, shortness of breath, also known as dyspnea. Number 3, swelling of the legs, feet, arms, hands, or abdomen, also known as edema. fatigue, which is feeling physically exhausted without mental exhaustion, or on the opposite side of the coin, lethargy, which is both physical and mental exhaustion, dizziness, and fainting unexpectedly or near fainting repeatedly. So if we start to notice a lot of these signs very often kind of showing up in our day-to-day life, it's something to definitely um, point us in the direction of maybe talking to our provider about. So what are the potential causes of heart disease? I've given a pretty complete list here of some of the major potential causes of heart disease, but right, some of these we kind of see and look at and think, I can't change that. I can't do anything about that, versus others we could. And so that's why we break these up into what's called modifiable and non-modifiable risk factors. So we'll go through that now. So to kind of start with those non-modifiable risk factors or things we can't change, right, for heart disease development. Number one, it's going to be our genetics or our family history, right? Mutations in our genes can lead to changes in how our body regulates vital body processes like our blood pressure, our cholesterol levels, our ability to utilize and consume glucose and insulin and stuff like that. And so it's very important, right, that we understand our genetic history and our family history of diseases for understanding our risks for heart disease. Next is our age, right? We can't change our age. Unfortunately, we haven't figured out that solution yet. So turning back the clock. So heart disease can occur at any age, but the risk definitely goes up as we get older. So as we start to get older, definitely starting to focus on our heart disease risk, and heart disease signs and symptoms is important. Next, our sex, right? So for both men and women, we commonly see heart disease as a leading cause of death in both of these genders, but typically the onset is a little different. With men, we see the onset much earlier in life than women, and we'll touch on that in just a second as to why. But that's something to think about. Men definitely start thinking about at a younger age versus women as we start to get a little bit closer to 60, 65 and later. Our race and our ethnicity is another non-modifiable risk factor for heart disease. Across all ethnicities, the highest risk seems to be prevalent in African Americans, American Indians, Alaskan Natives, and Caucasian individuals. The lower risk for development is in Asian Americans, Pacific Islanders, and Hispanic individuals, but I won't say it's significantly much less. It's just typically not the highest risk for those ethnicities. So all people are at risk for heart disease, but for some of us, we might need to be a little bit more cognizant. Next is our medical history, right? Our past medical disease states or acquired, right, genetic disease states can definitely have a huge impact on our risk for heart disease development. Number one, right, any exposure or past history or current illness with HIV and AIDS can significantly increase our risk for heart disease development. Any autoimmune diseases can also increase our heart disease development. So those can include things like type 1 diabetes, rheumatoid arthritis, lupus, Hashimoto's thyroiditis, Graves' disease, Sjogren's syndrome, and the list is pretty extensive, right? But certain autoimmune diseases can significantly increase that risk. History of chest radiation, typically seen, right, for breast cancer therapy, where that radiation is very close to the heart, can increase our risk. And lastly, menopause. And this was kind of going back to the thing with the age and gender, which, right, typically during menopause, right, we have changes in our sex hormones, which changes kind of how our fat deposition goes from, for women, more towards the buttock and thigh region towards more central adiposity in the abdominal region, as well as increasing some of the thickness of our arteries and increasing blood pressure, right? And so all of that kind of together increases women's risk of heart disease risk through kind of centralizing some of the adiposity or fat deposition and increasing that blood pressure and artery stiffness. So menopause is a huge time to really start looking at heart disease risk and ways to kind of combat that. And the last one is pregnancy. And I put a little asterisk here because typically with pregnancy, it's during individuals who already have pre-existing heart conditions are where we typically see the highest risk going into pregnancy. But heart changes can definitely develop during pregnancy as well, or get exacerbated if the pre-existing conditions already exist. which shows that 1 in 3 pregnancy-related deaths are commonly due to heart disease. So it's definitely something to make sure we speak with the family care provider for anyone who's thinking of starting a family soon or becoming pregnant soon to understand your risk and kind of continue making sure you're being monitored throughout the process for any sort of signs or symptoms of worsening heart function. So then we move, of course, to I like to say the bread and butter, which is the modifiable risk factors for heart disease, right? What can we change? What actions can we do to help improve and decrease our risk for heart disease? And so, no surprise, the first one for me, of course, is going to be our dietary intake, right? Excessive or poorly moderated dietary intake of several nutrients can lead to the development of heart disease. And these can include things like dietary fat, refined carbohydrates, alcohol, high sodium intake, and so on, which we'll cover today during our time together. Additionally, lipid cholesterol levels, right? Adequate control of our dietary fats over our body can significantly lead to increased risk for plaque buildup, artery hardening, and fatty deposits in and around our organs. So making sure we're keeping an eye on our lipid levels and modifying some ways to kind of keep that down can really support our ability to reduce that risk in heart disease development. Next, of course, weight status. Right, some little statistics here. I'm not going to push any sort of thing on that. We've heard it a million times, but right, for those with overweight status, BMI greater than 25, this increases the risk of heart disease development by 15% and also increases the risk of heart failure by 51%, which is pretty shocking that it can be that high. So, right, and that disease doesn't get or that risk doesn't get any less when we go even higher. BMI is greater than 30 or obesity status, right? It increases a person's lifetime risk of a cardiovascular event in middle-aged men and women by between 67 and 85%, which is pretty significant. So definitely something to make sure, right? We're keeping our weight status within normal limits as best we can, right? Through physical activity, diet, exercise, anything that we can do to make sure, right, we're reducing that lifetime risk of heart disease development and cardiovascular events. Next, we have, of course, physical activity levels, right? Largely sedentary lifestyles with minimal physical activity and structured cardio can lead to weakening of the vasculature and the cardiac musculature, which, of course, increases our risk of disorderly function and complications. So physical activity is largely important. Next, stress management, right? Consistent psychological stress, anxiety, poor mental health care, depression, all of these can largely increase our risk for the development of heart disease. And so making sure that we're taking care of how we manage our stress and who we talk to can really help mitigate that risk. The next one is alcohol consumption, right? There is no safe level of alcohol consumption, but consistent overconsumption, and those numbers are right greater than 7 standard drinks per week for women and greater than 14 standard drinks per week for men. And right, overall reduction in nutritious dietary intake with replacement with alcohol can significantly increase our risk for cardiac complications and heart disease development. Smoking activity and exposure, right? Use of tobacco and nicotine products can, or frequent exposure to that as well, right? With secondhand smoke can increase our risk for heart disease and also several other cancers. So another modifiable factor that we like to notify patients of regularly. Yep. And then mental health status, right? Again, kind of going into with stress management, right? Making sure that we are controlling our anxiety, controlling our stress, making sure we're getting plenty of sleep and recovery is very important for our heart and our blood pressure. And then lastly, right, comorbid disease management, right? Some of these are listed here, but overall, any disease with poor management, right, with healthcare follow-up or poor adherence to kind of the medical plan or medications can increase or lead and increase the risk of heart disease or worsening heart disease progression. So with all that said and done, how do we check for heart disease? The number one thing you can do is regularly see your primary care provider annually for a physical examination and talk to them about any signs, symptoms, concerns, family history, or anything like that, so that they can have a good picture and understanding of what might be going on and what the next steps might need to be, right? If they do identify that risk is present, This often leads to diagnostic and laboratory testing to follow, and I listed some of the kind of diagnostic testing that's pretty common for heart disease, right? An EKG, an echocardiogram, a CT scan or a computerized tomography, an angiogram, right? Some of these names here that you might have heard from your doctor, right? And so this will typically follow to kind of check and see, right? Is there any signs of any abnormalities that can kind of indicate that maybe there is something going on with the heart and heart disease is present, right? And so typically, if we do notice a positive finding, then that will typically lead to a referral to a cardiology office so that they can provide greater support and identification, diagnosis, and optimal management of heart disease or cardiac-related diseases or issues. So how do we self-check, right? For a lot of us who want to do it ourselves. How do we do it ourselves? I put two great online calculators here for you guys that you can use. And you can look these up on Google and they'll be the first result. I tested it myself. But from the American Heart Association, they have the PREVENT online calculator, which stands for Predicting Risk of Cardiovascular Disease Events. And they can provide a 10 to 30-year risk for cardiovascular disease, atherosclerotic cardiovascular disease, and heart failure. Additionally, the American College of Cardiology also has a risk estimator plus tool, but only for atherosclerotic cardiovascular disease, right? Typically, since that is the #1 disease that we see in the US, but it can provide a 10-year risk percentage for this disease. But one of the great tools about it is that it can also show you the impact of various therapies on reduction. So it can show you, right, how much risk reduction would stopping smoking being, or reducing alcohol consumption, or adding a statin, or something like that, to really give you a good picture of, right, overall how these things can help out our body and reduce our risk over time. And I do want to make sure of note for my younger audiences out here today, these calculators only assess risk for those older than 30 years old. So at this time, continuing to ensure, right, consistent, regular follow-up with your primary care physician and having those discussions with them is going to be your first line of kind of checking that disease risk. So we've discussed what is heart disease and how much it impacts us. Let's move on to the meat and potatoes, as we like to say, of the importance of nutrition for our heart health. So I always like to start, right? Why is nutrition so important? It is the gas to the engine. So if the heart is the engine, right, then the food and fluid that we consume every day is the gas. And just like with our cars, we have to be mindful of the type, the quality, the quantity of the gas that we're putting in every day so that we can make sure that that engine is running smoothly for years to come and taking us where we want to go. So nutrition is really, really important for making sure that heart stays healthy for the long term. Nutrients like sodium, saturated fat, fiber, and fluid all can impact our heart in both positive and negative degrees. And making sure we're optimally balancing those can be really helpful to make sure, right, that we're not having too much of something or too little of something that can lead to deficiencies or excessive toxicities. And we'll cover some of those today. Additionally, vitamins and minerals are vital for metabolic processes and ensuring ongoing healthy cardiac and skeletal muscle cells to continue to work, right? Vitamins are really, really prevalent in a lot of our fruits, vegetables, and whole grains, nuts, and seeds. But making sure we're getting enough of them is really important, especially if we do have heart disease, as a lot of medications can increase vitamin losses, like with diuretic pills, or reduce absorption of the vitamins and minerals through blunting of some of those pathways. Amino acids or protein also become vitally important for heart disease or heart or failing hearts, as they're very, very important for making sure we're able to carry oxygen to the body part, right? As the heart continues to struggle to pump enough blood, right? We need to make sure we're able to get that oxygen to all of the periphery, the hands, the feet, the head, as well as it also becomes an important intermediate for a lot of metabolic pathways, right? And so while the body's kind of in this what we call catabolic state or rapidly breaking down state, making sure we're having enough protein becomes vitally important to ensure we're not losing too much of our muscle mass that can really reduce our ability to do our everyday tasks, be active, and continue supporting our overall health and put us into this kind of what we call a doom spiral. And lastly, right, dietary components such as phytosterols, fiber, flavonoids, omega-3 fatty acids, right, some things we've heard all about. These can all support our nutritional status and heart disease risk. And so understanding the power of these nutritional components and how they may benefit our heart disease risk and severity really do kind of give us a lot of tools in our tool belt to help make sure that we're having a healthier and brighter tomorrow. So to kind of start and break down, right, some of the key nutrients for heart disease, I always like to start with sodium because it's one that we talk about a lot, and anyone who's ever, heard about heart and nutrition have probably heard about sodium. So with sodium, right, the element commonly associated with dietary salt, which is sodium chloride, it's a vital nutrient for our bodies. It maintains our hydration balance. It allows our nerves to conduct electrical impulses. It supports regular muscle functioning, which organs are muscles too, right? So it supports our organ functioning, and it maintains our blood pressure to ensure nutrients are transported both effectively and efficiently to the heart and limbs. And since our bodies are 50 to 60% water, we need that sodium to make sure, right, we're not having too little water retention or too much water retention. So sodium becomes very, very vital to supporting our overall heart and body health. Something that we always like to discuss is table salt or sodium chloride, the most common consumed salt in the US and globally, only contains about 40% of sodium by volume. So, right, so if we consume a teaspoon of salt, about 5.6 grams or 5,690 milligrams, that's only about 2,300 milligrams of sodium by volume, right? So that's where a lot of people definitely hear, right? Oh, I had, a whole 5 grams of salt. That's not the same thing as sodium because sodium is a component of salt and it's only about 40% of salt. So it gives us a little bit of leeway. I did want to point out that sea salt, rock salt, and Himalayan pink salt all contain about 40% sodium by volume. So they're not much different in the long term when we're discussing, which salt may have less sodium. They all have the same amount of sodium by volume. And so at this time, our most recent recommendations and consensus from the American Heart Association is less than or equal to 2,300 milligrams of sodium per day for a heart healthy dietary pattern. So trying to identify, right, how much sodium we are consuming and trying to get close to that number regularly can be really helpful in the long term for our heart health and our heart disease risk development. So I get a lot of discussion with a lot of my patients is, well, where does all my sodium come from in my diet? How am I over consuming, 2,300 daily? And so we see based on this wonderful graph provided by the CDC, kind of what it looks like where all of our sodium is kind of coming from for the average American. And I just want to say, it's a good graph, not my favorite. It's a little bleh. So I actually found a better one. So we're going to use this one instead. And so, right, so when we look at this graph, this pie graph of the sources of sodium in our diet, we see that the majority actually comes from foods not prepared at home, right? What we like to call pre-prepared foods. Anything that comes in a box, a bag, a can, a package, anything that is not prepared by us from whole grain food sources is considered, right, pre-prepared foods. And so we see really how this can account for, right, almost 3/4 of our daily sodium intake. And a lot of times, right, a lot of people will say, oh, like, well, I don't use a salt shaker at the table, and I didn't add any salt when I cooked it, and so I'm salt free. I'm barely eating any salt. That's unfortunately, right, looking at this graph, we can see that's only about 11% of our daily sodium intake. And so it makes a little bit of a little bit of change in the positive direction, but it's not going to make a major shift if we're well above or not even close to the 2,300 milligrams recommendation. So, right, so we can look at this and kind of be like, oh, well, what do I do then if I only control 11%, right? I only control the ones that I put in at the table and in my cooking. Well, how else do I control the rest of the pie, the other 89%? And so when we look at this, we see that the agency or our control is very low, but we can take that back. And that's through the use of looking at what foods we're bringing into the house, right? What pre-prepared foods we're bringing to the house or ordering. And we do that through food labels, right? The window into the food, the contents of the food is through the food label. And that's where we can see well, how much sodium is in per serving? How many servings is, how much that I'm going to eat? So we can kind of calculate and see, right, really how much sodium we're consuming in there. And that brings us back some agency because then we can be like, oh, well, this food has a lot of sodium and it's not going to be good for my heart. So I need to find a lower sodium option or just eat less of it or something like that, right? And so moving on along, right, what are the saltiest foods in the average diet? The American Heart Association came up with what's called the Salty Six. And these are the six highest sodium containing sources of foods in our average American diet. I will say, right, this is the highest sodium containing foods in the average American diet, not the highest ever sodium containing foods out there on the market, right? And so as we can see, right, bread, rolls is number one, right? Baked goods, because we need the salt in there to kind of help keep the moisture, help the bread rise, right? Kind of help bring some flavor, but we don't need too much salt when the average slice of white bread is between 200 to 400 milligrams of sodium. We see how quickly, right, when you have two slices of bread on the sandwich, or you're doing a foot-long sandwich, how much bread that is, or three baked croissants in the morning, right? Something like that can really add up the sodium pretty quickly from those breads and baked goods. Additionally, we also see there's some of these are combination foods like pizzas, sandwiches, burritos, and tacos, right? These are combinations of multiple higher sodium foods all together and then eaten in large quantities or regular quantities. So this is a little picture of kind of where we see the most amount of sodium consumed in the average diet. Some of you might be able to see this and say, oh, well, I definitely consume a lot of that. Maybe I should see how much sodium's in mine, or maybe see if we can, maybe reduce it a little bit so we still enjoy some of those foods. So I put in a little activity here at the bottom for you guys and anyone on this call. If you're interested, even if you don't have heart disease, consider investigating how much sodium you consume on an average day, right? So try to utilize a tracker. I put in a PDF down here, the AHA's sodium tracker. It's free. If you look it up on Google, it'll pull up and you can easily download and print it. But I usually say about 1 to 3 days to give us a good wide range of variety and kind of see where our sodium in our diet is coming from. And kind of once you get through those days, circle the top three, typically of your three highest sources of sodium. And I like to say, look at it in one of three ways, right? A, can we reduce or remove this food item? Right? So if we're reducing it, I usually say, right, maybe once a week or less than once a week, right? Less than 4 times a month. Or remove it, right? Just no longer I'm going to eat this food anymore. That's option A. Option B is how can we adjust the brand or the contents of this food, right? So for sandwiches, can we find a lower sodium bread or a lower sodium cheese or a lower sodium deli meat that can still ensure that we can enjoy our sandwiches, but not contribute so much to our daily sodium intake above, right, that goal of 2,300. Or lastly, right, for a lot of foods, right, it's option C, continue to consume this food, but then reduce the sodium of the foods around it or across the day. Right. So once we know that, hey, I know my breakfast egg cheese McMuffin is very high in sodium, but I'm not getting rid of that. That's something I love every day. I'm not going to change. Then, right, we can say, all right, well, the rest of the day, I need to make sure that I'm moving around my pennies, as I like to call it, of how much sodium I'm going to allocate over the day to make sure I'm still close to that 2,300 limit, but still enjoying a maybe slightly higher sodium containing food, right? Because food brings so much more than just nutrition. It's mental health, it's enjoyment of life. It gets us through some hard times, or it brings a lot of joy and memory back to us for like previous events. So definitely a fun activity to try if any of you are interested in. I definitely encourage you to. And then I always want to make sure that I give you some context when I give that to you guys. So based on the 2019 research study looking at estimated global averages for sodium intake across the globe, we saw that the average American diet in 2019 consumed 9.16 grams of sodium per day. So it's about 4 times above that 2,300 limit, right? 1 gram is 1,000 milligrams. So it's about 9,000 milligrams per day in the average American diet in 2019. And so, right, we're thinking, okay, well, that's just America, the US, right? The ranges for all the countries that they surveyed over the globe, the ranges were from 6.75 to 10.66 grams per day, with Barbados having the lowest sodium intake and Portugal having the highest at the 10.66. So whatever results you find, right, don't feel like you're an outlier if it's a little higher than that 2,300. Most people, unfortunately, are not anywhere near that number, and that's okay. Our goal is to reduce a little bit towards and try to stay close to it as best we can to support that heart health in the long term. Then, saying, oh, well, I'm too high up, there's no chance now. There's always a chance today. So looking at our next nutrient, we have saturated fats that you might have heard thrown around a lot or seen on the back of a food label. So fats are long chains of carbon and hydrogen atoms bonded together. So as we can kind of see, right, they're also termed fatty acid chains. We can see in this picture right here, right, two different types of fatty acid chains. With our saturated fatty acid chains, right, these are fully saturated in hydrogen bonds so that no other bonds can fit in, right? So typically we'll see all these H's and all these C's completely filled up and no space for anything in between. This typically produces a very straight and solid kind of fatty acid chain. While with our unsaturated fats, right, we have these double bonds, right? So two bonds are taken between two carbons, which reduces the number of hydrogen atoms that are on that chain, as well as creating what's called kinks in the chain, right? So then instead of having that straight line, we have a little more of a bend, right? And so there also are, if any of you have heard before, there are two types of unsaturated fats. If we have one double bond, like we do here in this picture, that's called a monounsaturated fatty acid. And if we have more than one double bond, then we have what's called a polyunsaturated fatty acid. So these are, can have multiple kinks in the chain. It can be extra curled or even circled around, while saturated fats will almost always be straight. So what are saturated fats, right? We know about how they look. What does that mean? Saturated fats are solid at room temperature. So always remember S and S. Saturated means solid at room temperature. So this includes things like animal fat, the marbling in our meats, the skin of the chicken, butter, ghee, right? Certain high fat cheeses, coconut oil, right? Things that are solid at room temperature with fat, right? These are what saturated fats are. Right, we can use them for cooking, like lard, tallow, pig fat, the marbling from the beef. But higher intakes of these saturated fats have been shown to, over time, increase our LDL cholesterol levels and have a higher risk for fat deposition in our arteries, right? That plaque buildup, or within organ tissue, right? So non-alcoholic fatty liver disease, we can sometimes see, right, with high LDL. Right. High intakes of saturated fats can be pretty damaging for the heart. Unsaturated fats, on the other hand, right, that are liquid at room temperature, right? So these are things such as our olive oils or avocados. Most nuts and seeds are actually very high in unsaturated fats, as well as our fish oils, right? And omega-3s, right? So these are unsaturated fats. They're going to be liquid at room temperature, and higher intakes of these, per our research, has shown that these can actually lower our triglyceride levels, increase our HDL cholesterol, which is considered, right, our good cholesterol. These are the things that remove cholesterol from our body and take it to be excreted and removed. So HDL is considered our good cholesterol or lipoprotein. And it can reduce our overall risk for heart disease and stroke. So higher in consumptions of unsaturated fats can be more beneficial for the heart than higher consumptions of saturated fats. So we typically encourage people to try to see how much you're consuming and modify it to increase and have more intake of those unsaturated fats than those saturated fats. So based on the most recent USDA guidelines, they recommend limiting the consumption of saturated fats to less than 10% of your daily calories, while the American Heart takes a little bit harder line and recommends less than 6% of our daily calories. And so I did some of that math, that mental math. So for we'll say an average 2,000 calorie diet, less than 10% of our daily calories turns out to be 22 grams of saturated fat per day. And for the less than 6 for that 2,000 calorie diet, that turns into 13 grams of saturated fat per day, which doesn't sound like too much, right? We're like, I don't eat that much butter. I don't have that much high fat milk maybe. For context, the typical milk-based creamer has about 5 grams per tablespoon. All right, so if we have 2 tablespoons in the morning, that's already about 10 grams of saturated fat. Half and half contains half, so it's about 2 grams per tablespoon. right? And so we can see how it can build up pretty quickly when maybe we have, right, some milk in the morning, higher fat milk in the morning, maybe a milk-based creamer, maybe we have some marbled meats with lunch or dinner, right? And maybe use some butter in the morning for toast or for bread, and bagels, right? We see how that saturated fat can really build up and how difficult it can be to really get to that less than 10% or less than 6%. So any movement in that area can really support our heart health, really reduce our risk for plaque buildup, heart disease, atherosclerosis, all of the above. Um, so that's definitely another recommendation for nutrition and heart health of try to look at and see, right, maybe that's something we can modify and work on. I do want to make a little asterisk point because it's something that I've discussed many, many times with patients, in that when we replace saturated fats with unsaturated fats, this has shown a statistically significant improvement, right, in overall heart risk disease and stroke development. But when we replace saturated fat with processed carbohydrates, and I say processed, right, things that are removed the fiber, right, highly, like white flour, white bread, right, where we've removed kind of a lot of the nutrients, enriched them back in. It's more not so much whole food based, right? That has actually shown a net neutral or even a slightly higher risk in heart disease and stroke development. So we want to make sure, right, we're replacing those saturated fats with unsaturated fats and not replacing them with higher processed carbohydrates. So I bring this up because a lot of times when patients are like, oh, well, I'll lower my creamer, right? I'm just going with that example. I'll lower my creamer to maybe like a plant-based creamer, or like a lower fat creamer that's flavored or something like that. We might be reducing the saturated fat content, but those might also increase the added sugars, right? And so then we're replacing those saturated fats with instead, right, more of those processed carbohydrates, which can lead to that overall net negative or overall net neutral change, which overall, right, kind of reduces the impact that we were trying to have for our health. Additionally, right, when we reduce our overall fat consumption, fat's really important for our satiety or feeling of fullness. So when we reduce our overall fat consumption with saturated fats, it's not uncommon for a lot of people to start feeling more hungry much faster after meals or between meals. And unfortunately, some of that time, right, it gets a little bit easier to go get snacky, grab quick, convenient foods, which might be higher in those saturated fats, than some like our bars or candy or something like that, or higher in those processed carbs. So definitely working with a nutrition professional can be really helpful in identifying and planning for, right, when we reduce the saturated fats or kind of try to change, right, where our sources are coming from, how to kind of do that in a smart and balanced way. So moving on a little bit, right? We talked about, saturated fats, and right, its impact on kind of our cholesterol levels and stuff. We also want to make sure we're looking at our plant sterols and stanols, also known as our phytosterols, which they are essentially the plant version of cholesterol, right? They're a very similar structure and function to cholesterol found in plants. And so when we consume them in like our fruits, vegetables, whole grains, right, they compete for absorption in the body during digestion. So, right, if they get absorbed, that can mean that that site is no longer, right, open, and cholesterol then becomes wasted and removed through our stool, which therefore can lead to reduced levels of absorption and consumption of cholesterol, which helps for those who might have higher cholesterol or higher risk for atherosclerosis. Right, so regular and high consumption of these phytosterols can help manage cholesterol, and overall reduce the risk of cardiovascular disease, heart attacks, and strokes. So the recommended intake is between 1.3 to 2 grams of these phytosterols. I will tell you it's very hard to really know how much is in them. So I overall like to recommend, right, having a sufficient intake of fruits, vegetables, beans, legumes, whole grains, nuts and seeds, right? All of these sources high in these phytosterols, versus trying to calculate it all out by saying, right, how much is in this strawberry? How much is in this thing, right? So that gets us to the big point, right? What are some heart healthy patterns for heart disease? And so the first one, I'm sure everyone here is probably familiar with, is the Mediterranean diet. It is often touted as the top dietary pattern for year after year for both overall health, heart health, and even weight loss. And I want to make sure, right, that it does say dietary pattern. The benefit of the Mediterranean diet is that it is not a diet. It's not restrictive. It's not judging. It is very much a dietary pattern. It gives you a framework and a structure to kind of envelop and include healthful eating habits and physical activity habits. And so this one overall for any individual with heart disease risk or overall health kind of concerns, the Mediterranean diet is a wonderful dietary pattern to help and support there. Next, for those who might have high blood pressure, the DASH diet or the dietary approach to stop hypertension is usually the recommended dietary pattern, right? Another highly regarded pattern that again is not a restrictive or judgmental diet. It is a framework, right? And this one focuses more on limiting our saturated fats, our sodium intake, and processed carbohydrates. And so another excellent diet. They do have a little bit slightly different recommendations than the Mediterranean diet, but they're very similar in a lot of ways. And so another great option for those who may be not a fan of the Mediterranean diet, and also want to kind of see something else that might help with the blood pressure concerns. Another one is the therapeutic lifestyle changes dietary pattern, or the TLC, the tender love and care diet pattern, which is really helpful for those who might have high cholesterol, as well as anyone with heart disease risk. This again focuses very much on diet saturated fat consumption, as well as dietary fiber consumption, right? So kind of with those plant sterols and stanols, right? They're decreasing that saturated fat while increasing that intake of those phytonutrients and that fiber intake that's going to help reduce the overall cholesterol. It is a component of the TLC program, which is through the National Heart, Lung, and Blood Institute. And so this is just a component of their entire program, which encompasses the dietary intervention, the physical activity intervention, and their weight management intervention. So if you're ever interested, I highly encourage you to check out their website. I think they still do classes, courses, and stuff on that for anyone interested in the TLC diet. And lastly, not really a diet, but a huge, huge benefit and nutritional pattern for anyone with elevated triglycerides, heart disease, and overall well-being is moderation of our alcohol consumption, right? Alcohol is converted in the body into triglycerides, similar to simple sugars and excess calories, right? So the more alcohol we consume, the more triglycerides can increase, which triglycerides in simple terms are mobile forms of fat for energy and working muscles. So it moves around our blood to provide energy to our organs and our muscles. But having too much of that can increase that risk of hardening and plaque buildup. So it's important to not have too high of triglycerides, and alcohol is typically a major contributor for most individuals of why that might be a little bit higher is overall, right? It's a little bit too high of alcohol consumption. So again, right, making sure that in the long term, right, we're trying to maintain within those recommended limits, right, no greater than 2 standard drinks per day for men, no greater than 1 standard drink per day for women. But overall, looking over the week, right, no greater than 7 per week for women or greater than 14 per week for men. And that can really support overall, right, increasing or decreasing our triglyceride levels and supporting our long-term heart health. Whoop. So a question I get a lot of is which supplement should I take then for my heart health? And it is a highly contested one, but I can tell you through multiple research, I have a library of books and a library of journal articles I have read. I can safely and sternly say there are no current dietary supplements that show clinically significant impact on overall heart health and heart disease risk reduction in the long term, unless, always an asterisk, there is clear deficiency or circumstances existing, in which case discussion with your cardiologist or registered dietitian should be had before starting any new dietary supplements. Right. A lot of times we hear a lot of this marketing out here. This new supplement, take it 3 times a day, once a week, 4 times, in the morning, and your heart disease risk goes away, your lipid levels improve, your body fat melts. Unfortunately, the long-term reviews of that has not shown that to be true. And so at this time, there really aren't any that for everyone in reducing heart disease risk that there is significant long-term benefit from. Now, some that I would personally recommend for most individuals, right? Not at all saying that this is an intervention or a nutrition plan for anyone here on this call. But from my personal experience with most individuals, I'd recommend first and foremost, right, a multivitamin, multimineral um, supplement for most days or daily if you're interested, as this can really help what I like to call be our insurance policy for our health. It really does make sure that we're getting adequate intakes of these important and vital nutrients daily. And just definitely make sure, right, whichever brand or whichever one we go for, that we check for seals of quality, typically the NSF International, the USP, the Underwriters Lab or Consumer Labs. These indicate that the ingredients listed are actually present in the described quantities and that no harmful ingredients are included in the supplements. Additionally, I highly encourage most individuals to avoid anything with mega dosing, right? So typically that's any qualities greater than 100%. That's not an umbrella statement. There are sometimes, right, especially as we get older, we might need a little bit higher quantities than the overall RDA. But overall, for most of the time, if you see something that has like everything is, 1,000%, 500% of the daily recommended, it's something that we'd want to be cautious of because while yes, we can pee out some water-soluble vitamins, some fat-soluble vitamins and minerals can still build up to toxic levels within the body or reduce absorption of other minerals, which can lead to deficiencies down the road. So avoid too high quantities or what's called megadosing. Secondly, right, vitamin D, very important for us out here in the Pacific Northwest. Right, so we have a daily recommended intake of 600 units for vitamin D for those under the age of 70, and for those over 70, 800 international units per day. You can get these from our food sources like fatty fish, fortified foods, and mushrooms. And overall, right, it can be really, really supportive of our immune system, our bone health, mental health, and so many other things. Just avoid supplementing with large doses again, right? You typically can find on the shelves, right, 5,000, 10,000, 20,000 international unit supplements. These are only if we have, right, a deficiency or a known deficiency, and that's recommended or prescribed by your doctor to take. If we over consume vitamin D, that can actually lead to issues with calcification of our arteries. And that can then in turn lead to even worsening issues for our heart than if we hadn't taken the supplement at all. So definitely be cautious with vitamin D, how much we're taking. A lot of times you can get it from your multivitamin and from your daily food intake or from being outside for a few minutes with some sun, some exposed skin. And lastly, adequate fiber intake is very, very important. I typically recommend getting it from food sources, whole food sources over supplemental forms, but here are the recommendations for men and women per the USDA. So what is the number one supplement that I do recommend? Exercise. Exercise is very important for our overall heart health and longevity. And so it's really important to support and make sure that we're getting adequate exercise daily and weekly. Aerobic exercise, even in the absence of weight loss, has shown a significant reduction in visceral adiposity or abdominal fat, hepatic fat or liver fat, fat around the heart, and fat within the heart. So it's very, very supportive of our overall health and well-being and our fat levels that can increase, right, that risk of hardening arteries, plaque buildup, and cardiovascular disease. It also improves insulin sensitivity and vascular functioning and reduces pro-inflammatory markers. Again, all regardless of weight loss. So even if we aren't doing this to lose weight or our weight never changes, under the hood, right, what really matters is also is improving at the same time. All right, and so a big thing, right, that really does show in the research, right, low physical fitness overall has been significantly associated as the principal risk factor for heart failure across all BMI categories. So even if we're within normal, our BMI is within the normal range, our BMI is in the underweight range or in the obesity range, regardless of your BMI category, having a low physical fitness and not engaging in regular structured exercise has been associated as the number one leading cause of heart failure for everyone. And that can explain close to 50% of heart failure risk associated with all BMIs. So very, very important to make sure that we're getting regular exercise. So if you walk away from our call today, I hope all of you get my prescription for some daily physical activity and exercise. It doesn't have to be too much. Just every day is a new day. Try to get a little bit of some fun exercise in there and a little bit of way to move our body and support our overall heart health. So I listed here just a few ways to increase our physical activity, right? Always start slow. Don't think overnight you can go from not exercising to exercising and love it, want to do it every day, or be able to do it every day. It takes time, just like anything, like learning the piano. We have to kind of build it in, learn it, go through those trials and errors. And so start slow, break it up if you have to. Try to start with a lower intensity or moderate intensity before building up into those higher intensities. And then find a modality or type of exercise that you really, really enjoy doing. If we don't enjoy doing it, we're not going to stick with it, right? So there's so many ways to get active out there. Find one that you like or find a new way to do one that you do like. Can be really, really helpful for overall heart health. And even if we do have heart disease, exercise can significantly improve our heart functioning and improve some of our symptoms and limitations. Now, I know we're coming up on time a little bit, so I want to make sure I get through these last few, but I'll go through them a little bit faster. Weight management, right? Very, very important as well for overall heart disease risk. So making sure we're managing our weight is going to be really, really helpful. Excessive abdominal adiposity, right? The one that sits around our abdomen is a strong marker of cardiovascular disease. And this can typically be measured through a waist circumference, right? So measuring our waist circumference, measuring our waist to hip ratio, or if we ask our doctor, we can get a sagittal abdominal diameter through an MRI scan. We can also assess our risk for overall heart disease risk from our central adiposities through what's called the body fat percentage. And that typically utilizes like skin fold calipers, a BIA scale, a body roundness index, or a DEXA scan. I will say BMI is a weak variable for predicting estimated body fat percentage. So actually using some of those tools are much more supportive of knowing what our true body fat percentage is and what our risk can be and impact towards heart disease. And of course, the norms are very different by sex and age group. So I'm not going to list them here, but I highly encourage you if you're ever interested and you do get your body fat percentage to see kind of where you fall in that risk and maybe if that would be something to work towards in supporting and reducing our risk. So I'll skip this part here because it kind of covers what we've already discussed a little bit today. But I will say, right, everyone's like, well, I want to lose the 10 pounds or I want to lose 5 pounds. You know, how much of a difference is that going to make? Based on a recent look ahead trial, obese individuals who lost greater than or equal to 10% of their body weight, right? So if we're 200 pounds, we lost 20 pounds. They had a significant reduction in their cardiovascular events. And this was just through diet, through lifestyle modification, through exercise and diet, right? So not major changes, but really supporting overall reducing those cardiovascular events and cardiovascular risk is really, really helpful from doing just a small amount of weight loss. And then also, right, we see these new pharmacological agents like GLP-1s, GLPs, such as Wegovy and Zepbound. Those have also shown a lot of cardioprotective benefits as well through meaningful weight loss. So another thing to talk about with your primary care provider, if that's something that's interesting to you. The last one that we're going to talk about today, of course, is stress management, right? Like we said, poor stress management can really increase our risk, right? Because that adrenaline engages that fight or flight response. Our cortisol goes up, which reduces our non-essential functions, right? So our immune system goes down, our digestion goes down, and it increases that breakdown of our stored glycogen, which is our stored glucose, right? Our blood sugar, and which can really lead to increased desire, right? When we're out of that stressful situation to then crave simple carbohydrates, right? Immediate carb choices to raise those glycogen stores back up to normal, right? And so this is why, right, it's really, really important to make sure we're controlling our stress and kind of keeping our stress and anxiety under control. And there's really no best way to do that, right? I wish I could sit here and say it's so easy. Like there's one thing, drink this tea. There's not, and it's different for everyone. So I listed a few here, right? Finding and working with a licensed mental health counselor or therapist regularly. Exercise can also significantly increase oxytocin and reduce stress. I always like to say, right, try to identify that largest stressor and seek a professional, right? If it's finances, if it's housing stuff, if it's family stuff, try to find a professional and talk to them and get some help in how to kind of take on those stressors to reduce it. I also am a big proponent of box breathing, or some people might call it a 4x4 breathing, where you breathe in for 4 to 5 seconds, hold it for 4 to 5 seconds, breathe out for 4 to 5 seconds, and then hold it for 4 to 5 seconds, right? As if it were a box. And this is significantly shown an ability to kind of help bring down some of those stress hormones and really support overall reduction in anxiety and stress. But that's just some of the ways listed. There are multiple ways, and whichever one works for you is going to be the best. So, in summary, heart disease remains the leading cause of death in the US, and someone is dying from a cardiovascular disease every 33 seconds. There are multiple risk factors for heart disease, and some of these are not modifiable, but the ones that are, those modifiable ones, we can start working on today to lower that long-term risk for heart disease development. Nutrition does play a key role in supporting our overall health and our heart health. So if you have or are at risk for heart disease, nutrition is vital and something definitely to look into and make sure that we're sticking to some of those recommendations or close to the best we can. The best thing we can do for our heart is physical activity and exercise. So finding ways to be active, reduce sedentary behaviors, finding ways to move if any time we have is going to be helpful in the long term. And lastly, talking to our PCP regularly and knowing our risk and finding ways to reduce that is going to be helpful. And always seek a professional for support and advice regarding any dietary patterns or supplements and appropriate exercise regimens and safe weight loss and effective mental health counseling before beginning. So I've listed here just some local resources to you guys. Of course, the Providence Community Wellness has an array of these wellness courses that are helpful for multiple things, as well as registered dietitian services if any of these nutrition or meal plan stuff that we talked about today seems of interest to you. Additionally, for ways to get active, Silver Sneakers is an excellent way if you have it included in your Medicare Advantage or Medicare supplemental plan for free in-person gym access or free online exercise classes and videos. Additionally, the Providence Cardiology is always open and offering support and guidance to those who might have heart disease or cardiovascular disease, as well as the American Heart Association, which is an excellent resource for additional education and learning and ways to connect to others who might have heart disease. So listed here are all my references, but I just want to say thank you guys so much for joining me today for our session. I hope this was informative and educational. I apologize, we have only 1 minute, but I'll try to answer any questions I can that we have left for today. But again, my name is Matthew Kokos. It was a pleasure, and thank you for your time.
Thank you, Matt. That's good information and perfect for February with it being Heart Month. It's helpful and applicable always, especially here in February. And I do have a couple questions here, but I think in the interest of time, because we're at time right now, I've written them down and I will send them out via email when I send this recording to make sure we get all your questions answered. So I will hang out here for a few more minutes. If anyone has any last minute questions, feel free to put them in the chat and I will send them all over to Matt and make sure that they all get answered. So I'll hang out here for a couple more minutes, but again, thank you, Matt, so much. We appreciate your time and all your wealth of information that you have.
Thank you.